These are images of Highway 63 south of Fort McMurray. Smoke as far as the eye can see as people escape that wildfire. There are concerns about the impact this smoke is having on air quality and on people's health. So joining us for more on that is Dr. Joelene Huber. She's a pediatrician and professor of medicine at University of Toronto. So we've been seeing this fire burn for a couple of days now, and now we're seeing this haze. What sort of effect could smoke have on people's health?
Well, the effect that it has on people's health really depends on the length of time that they're exposed, how much smoke they're exposed to, and of course their health condition. When we think about the composition of smoke, it's all those little particles. So when you're exposed to smoke, you start to get irritated eyes, nose, and throat. Those are from the big particles, but there's these small particles that makes that haziness and reflects the light. They're particles, to put it in perspective, that are 1/6 the size of a human hair or even smaller. And so those tiny particles can get down into the lungs when we breathe them in, and that's what can cause respiratory issues, so trouble breathing, shortness of breath, coughing, phlegm, and it can be quite severe for some people, particularly if you already have a lung or heart condition. Those are the people that can be most susceptible, but even people that don't have health conditions can start to have symptoms, and our system, our lungs can't clear that as well. It affects our immune system and ability to get those, so we start to have coughing, wheezing, shortness of breath when we're exposed, and of course carbon monoxide, so the firefighters that are front line. And as the smoke and fire starts to smolder, there's increased carbon monoxide. So those are the things that are in the air that are making it hazy and can affect our health.
A lot of things to be concerned about. And we have a map where we can see that the fire from the Fort McMurray wildfire, it's spreading into other regions, right? So we're seeing the smoke spread to Alberta, Saskatchewan, British Columbia, now even the Northwest Territories.
Right.
So what kind of people are more at risk? I guess anyone, like you said, with breathing problems, but are we worried about children?
Yeah, so elderly are always most at risk, of course, as well as children. So especially young infants, we think about their airways. They're really tiny airways, so when those start to react and restrict to that smoke inhalation, they have less ability to cope with that because their lungs are just not as developed. And children are outside a lot more than adults. They're more active, and the more active we are outdoors, we breathe in, you know, when you're running, you'll breathe through your mouth, so you're breathing the air right down into your lungs, and you're breathing 10 to 20 times more than you are at rest. So again, you're being more exposed. So children are particularly vulnerable, elderly, and then those who have lung disease, so asthma for sure, chronic lung issues like COPD, emphysema, if you have pneumonia, all of those people are much more susceptible to have those kind of triggers at this time. Pregnant women, we also think of a theoretical risk because smoke is kind of like cigarette smoke. So wildfire smoke has some of the same compositions, and we know that that's not healthy for pregnant women. So we say for everybody to take precautions, but particularly those that are most at risk.
And so what sort of precautions could someone take in conditions like this that we're seeing in Fort McMurray?
Yeah, so you really want to try to just limit your exposure. That's the number one thing. So staying indoors, and if you have an air conditioner, if you can turn it on to recirculate the air so it's not pulling in that air from outdoors. And again, you just want to keep that air quality as good as you can indoors. So don't do anything that increases poor air quality. So of course, smoking is a common thing that we think about, but we also don't often think about just candles, incense, even frying and broiling our foods, using gas fire, using the gas stove or gas fireplaces can all, vacuuming, all of those can increase those particles in the air that can then cause more air pollution indoors. If you're driving, you want to close your windows, again, put your vent on recirculate, and then stay indoors and don't do vigorous exercise because, again, you're breathing in a lot more of that smoke if you're even outside gardening. And so drink lots of water is another good thing to do because that keeps your mucous membranes and your nose and your nasal passages moist as you're breathing.
Yeah, and the driving is a great tip because thousands of people are still doing that, trying to get away from the wildfire.
Yeah,
right?
so you want to close off the vents as much as you can. Maybe open it every once in a while to let some of the carbon dioxide out, but then again, keeping it closed and making a nice clean air circuit as much as you can in the car is important.
Okay, Dr. Huber, thank you so much for these tips.
Thanks for having me.
Dr. Joelene Huber is a pediatrician and professor of medicine at University of Toronto, joining us here live in studio.